Causes of colon cancer in young adults going up inexplicably. And, the part that really kind of stood out to me, Chris, is where it talks about what we'd ordinarily talk about with, risks of colon cancer, which would be, for example, diet, right? And perhaps weight, maybe. Yep. But in these particular cases, and there's an example here of a man, 30 years old, it's the one they start with in the article, in great shape, not overeating, has a good diet, all that kind of stuff, at 30, and gets diagnosed with colon cancer. So how prevalent is this, and why is this happening?
Yeah, so here's the thing. We have to put a little bit of nuance, and some of the headlines and some of the language they use in the article may be not entirely accurate. Like when they talk about rates of colon cancer skyrocketing, I think that's a bit of a misrepresentation of what's actually going on. So here's the thing. Colon cancer overall is actually decreasing in this country as it is in most of the developed world because we have gotten very, very good at cancer screening, right? We do either colonoscopies or fecal occult blood testing. We remove polyps before they turn into cancer. So overall, colon cancer is going down. And in the group of people 50 and over who make up the vast majority of colon cancer cases by like a factor of 8 to 1, colon cancer rates are going down. Why people are talking about this and why they're able to generate these types of headlines is because when you break it down in people under 50 versus over 50, the people who are under 50, who still represent the minority of cases, have been seeing a bit of an uptick in colon cancer over the past 20 years. So it's not as if this has happened suddenly. It's been a slow, steady increase over the past couple of decades to the order of about a 2.8% increase. And that's the number we've been seeing in Canada. In other countries across the world, it's actually been a little bit worse. It's about the same in the U.S. at 2.1%, much higher in Puerto Rico at 3.8%, the U.K. is 3.6%. So all this to say is that you are seeing an increase in colon cancer in younger people. I think a lot of it is explainable by the things that you mentioned: diet, rising rates of obesity, especially in younger people, the fact that younger people are not usually included in cancer screening programs, so you're not going to pick up these cancers earlier and treat them earlier. So I think a lot of this is explainable, and it's not as much as a mystery as some people would like to make it out to be.
Okay, well, let me go to a couple of things here. I'll tell you what stood out to me. There's one of the sentences here says, everyone born after 1960 has a higher colon cancer risk than previous generations. That in and of itself is concerning, is it not?
It is, except that it depends how you define colon cancer, right? Because everybody born after 1960 probably became part of a colon cancer screening program where you had, either blood tests, fecal occult blood testing or colonoscopies. So you're going to pick up more colon cancer just by virtue of the fact that you screened for it, whereas previously a lot of it would go undiagnosed. So yes, you are going to detect more colon cancer just by virtue of the fact that you have better screening. You're just going to catch it early and prevent it from metastasizing and turning into a fatal case of colon cancer. But part of it is reflected in the fact that our lifestyle, the fact that we eat more processed foods, the fact that we move less, the fact that we're seeing rising rates of obesity, all of that is contributing as well. So there are two competing forces at work here. One of it is a force for good, that we are much better at screening and treating colon cancer than we've ever been. But part of it is our lifestyle is maybe a little bit worse than it was a generation ago, and that's the part that really needs to be focused on and fine-tuned.
So let me ask one other thing here, and I know this is a U.S. figure, but it says that back in 2021 in the U.S., right, they moved the age of recommended colon cancer screening from 50 to 45. What have we done here in Canada?
We've been staying at that. Now, colon cancer screening is always, and with every cancer screening, it's always an interesting problem because you could say that, well, why wouldn't we liberalize the guidelines to catch more of these people? But let me give you some numbers here, just because, if there's one thing that people love when they hear about health, it's hearing about statistics. I firmly believe that. The rate of colon cancer in the people over 50 is about 117 per 100,000, whereas it's only 13 per 100,000 in the younger people. So it really is almost less common by a factor of 10. If you were to implement a colon cancer screening for the younger population, it would invariably become more inefficient. That's not to say it wouldn't work and it wouldn't be a good idea, but it would cost more for a lot less return on investment. And now you're getting into a much more complicated question about, healthcare utilization spending and resource allocation. Like, do you want to spend resources on this as opposed to something else? The younger you push the age cutoffs, the less useful they become, because the fewer and fewer people have colon cancer. And even with this 2.8% increase in younger people, they still represent a very tiny minority of all colon cancer cases. And that's where this becomes very challenging, which is, can you lower it to 45? I suppose you could, But then how far down do you want to push it? Do you push it down to 40 or 35? If we keep seeing an increase in the prevalence in younger people, then yeah, maybe it does make sense to push it down a little bit. And those numbers are always going to be a little bit fluidic and a little bit arbitrary based on where the cost effectiveness analyses lie.
So just a final question from a doctor's point of view here. When is a recommendation for someone to go for a colon cancer check, test, et cetera?
For the general population, probably be in their 50s. But if you have high-risk features, if somebody in your family had colon cancer, and especially if there's a genetic condition that leads to colon cancer, of which there are many, that's an indication to start earlier. And so that's the thing. Even guidelines, when you have these ages of 50 or 45, those don't necessarily apply to you.
Okay.
Your individual risk may justify starting earlier.
Is one of them, by the way, because I know in the story he talked about having a stomach ache that went on for a month. I mean, obviously that's a concern. That's something you want to follow up on?
Exactly, but that's not screening. Screening means taking an asymptomatic population and doing tests on everybody, even if they feel fine. The minute you have symptoms, go get testing because those symptoms might be driven by something else.
Dr. Chris Labos, as always, appreciate it. Thanks so much.
My pleasure. Take
All
care.
right.